afternoon, everyone, and thank you for joining us for our Rural Roundtable event through the Rural Violent Crime Reduction Initiative Program, or RVCRI for short. My name is Samantha Reinierson, and I'm a program manager at the National Policing Institute for the RVCRI team. And I'm joined today by Juliana Palmer, who is a policy advisor with the Bureau of Justice Assistance, and John Connolly, who is a senior program officer with the Local Initiative Support Corporation, who all work together as a part of the RVCRI team. Before we dive into today's presentation, I do want to go over a couple of housekeeping and event logistics. First, the event is being recorded, and we will make that recording available on the RVCRI website. 2, all attendees have been muted to prevent background noise in the event. 3, there will be a brief event survey at the end of today's event. We do ask that you complete that. It should only take a couple of minutes of your time. We do take that feedback and use it for our future events, so any of that does help us improve. If you also have any suggestions for future event topics, that event survey would be a really great place to provide those. Lastly, at the end of today's presentations, we will have the facilitated discussion portion of the roundtable. So if you do have a question or a comment along the way, please feel free to put those into the chat or the Q&A feature that you see at the bottom of your screen there. If you would like to come off of mute to make a comment or ask a question, please use the raise your hand feature so that we can call on folks and bring you off of mute. And that just helps prevent folks from talking over one another throughout the event. So what do we plan to do today? One, we're going to have a presentation from our guest speaker, Mike Hatch, who's a senior program manager here at the National Policing Institute. And then we will have 2 grantee presentations, one from Crawford County, Wisconsin, and the other from Mifflin County, Pennsylvania. And then, as I said before, we'll open it up for our facilitated discussion question. With that, before I turn it over to Mike, I'm going to give a brief introduction as to who Mike is. I mentioned he's a senior program manager here at NPI. Before he joined NPI, he was a project associate with the Policy Research Associates, where he worked on several criminal justice and SAMHSA-related grants, specifically targeted toward behavioral health crisis response. And before doing grant-related work, Mike was former law enforcement and retired out as a lieutenant from the Johnson City Police Department in upstate New York. With that, Mike, I will turn it over to you. The floor is yours.
Well, thanks, Sam. Hi, everybody. I'm really happy to be here. You know, when I was asked to be part of the Rural Violent Crime Reduction Initiative team, this is something that's really dear to my heart. I started my law enforcement career back in 1993. And I had probably one of the coolest jobs you could ever have in law enforcement. It was a very small 15-person police department, but I was a part-time dispatcher, a part-time fire truck driver, and a part-time police officer. So I would tone out the fire call. I would call the police officer in off the street to cover the desk, and I would take the fire truck and respond to the scene. It was the coolest job you could ever have as a first responder. Did that for a period of time. And ended up finishing my career in a very urban area, but yet still a very small police department in urban upstate New York community, but it was still very rural area, so very small area. So this is a topic that's very dear and near to my heart. Very happy to be here. Next slide, Sam. So I'm going to go through a couple things that I've had the privilege to work on throughout my career and even since retiring. These are some topics about sequential intercept mapping and how there's opportunity to connect and collaborate in your communities using a sequential intercept model map as a tool to do that. And I'll explain what that is if you're not familiar with it and talk some about that. I'll also talk about call taker and dispatcher protocols, particularly 911 diversion, and how there may be opportunities to divert calls from a law enforcement response and get the calls to the proper behavioral health specialists that may be available in your community. And also provide some information on training and crisis response and intervention and some of the newer new things that are out there that have just recently been released. Next slide. So sequential intercept mapping, or the sequential intercept model, if you're not familiar with it, it really depicts how adults with behavioral health conditions can move through the criminal legal system. We can do a pretty good job of predicting how they move through this system. And it's been designed and broken down into specific intercepts. And you see it starts at intercept 0 before law enforcement is even involved with any sort of crisis care opportunities you may have in your community, crisis lines, and I'll talk a little bit more about 988, which your community should have available to you now. It's been out for a while, and we'll talk about that some more. But then it moves into intercept 1, and you'll see in intercept 1, there's kind of an overlap between intercept 0 and intercept 1, where there's opportunities for law enforcement to go backwards and provide referrals and different things to our community providers that might be available. We may be aware of them, we may not be aware of them, or we may not have that relationship or connectivity yet to do certain things with them. And then it continues through the system, as you can see here. We often know we know a lot about our intercept and where we sit in this sequential intercept model, but a lot of times we don't know a lot about the other intercepts and how they work. So a sequential intercept model really brings everybody together that represents each intercept, and it allows us to have conversations about how people flow through the system and what our roles and responsibilities are and how we can communicate those to each other and work together collaboratively. Next slide. So it really, like I said, the biggest opportunity is it looks at what you currently have within your community, what's available, and where we can identify those gaps. And gaps can also be opportunities. And you typically walk away from a mapping workshop, which often takes about a day and a half to do. Usually takes about 3 to 4 months to plan a sequential intercept map workshop. And then a day and a half of actually in person, in the same room, figuring things out, drawing on huge Post-it notes and different things, and walking through the system to identify gaps and opportunities. And then you leave those with an action plan. And the nice thing about the action plan is it really gets everybody invigorated and excited about what you can do together to help guide people out of the criminal justice system, or keep them from even entering it at all. So there's a lot of opportunities to work together. It's one of the first steps that are often recommended when you're looking to build some sort of crisis response community collaboration, because it brings everybody together and gets everyone on the same page so we all have a good understanding of what our roles and responsibilities are. The QR code you see here on your screen provides more information on that if you were interested in it. Next slide, please. So this one's really special to me. So what you'll see here on the left-hand side of your screen is a risk assessment tool. When I retired from law enforcement in 2016, one of the first things that I had the opportunity to do was read a sequential intercept report that was done. And I had never heard of sequential intercept reports or models or anything before I retired in 2016. I read this report and I knew this ahead of time, but it totally made sense when I read the report. We had an over response to 911 calls for people in emotional distress. We were sending too many cars, and we were sending cars to every single call. So I wanted to try to collaborate and work with our community and talk about what's an opportunity or a way to divert some of these calls. Do we even have a location to divert it to? The $1 million question in policing is divert to what? And that's one of the questions that we always try to answer when we're looking at building some sort of collaborative thing. The other issue is that if it's divert to what, it can't be divert to when. There can't be a time frame, because a lot of times, well, you can do this one 8 to 4, but you have to do this one after hours. It gets super confusing and frustrating for our patrol officers. And many times we know that if our patrol officers try it once or twice and it doesn't work, they may never try it again because they're going to get frustrated with it. We have to really build this systems out. We have to pilot test them to make sure that they're going to work. It's kind of like when you develop a business plan, you want to pilot test whatever the product is before you roll it out wide. So we take baby steps with these types of things and look at it. So the thing you see here on your left is a risk assessment tool that I developed with my team back in Broome County, New York. And these are specific questions that the dispatchers can ask. Typically when a dispatcher, many times when a dispatcher takes a 911 call and the person says, "I'm thinking about killing myself," that's often an automatic response by law enforcement. It doesn't allow, many times it doesn't allow dispatchers to dive in a little deeper to that question. Well, do you have a plan? Have you gathered the means? What's your time frame? Those types of things. So we took a lot of our playbooks from our mental health professional partners and said, how do you allow people to walk out of your office knowing that they're having suicidal thoughts? And they developed these safety plans and things like that. So we kind of took it back and said, okay, our 911 dispatchers are not clinicians, but is there opportunity for them to ask some of these questions and then directly connect those folks with those clinicians over the phone? At that time, way back in 2016, we didn't have co-response or mobile responses or any of those things because the funding was just starting to get large back then. So we looked at this tool. We had a crisis call center right at our hospital, and we were connecting people right over the phone with our crisis call center at the hospital for follow-up. And it had success. It's been replicated in Westchester County. Rapid City, South Dakota has replicated this model. And there's a lot of promising practices that are out there that are very similar to this. Westchester County, I had a real good opportunity to work with them. This is the tool that they developed. It's identical to the Broome County model. The biggest thing that they did is because they have more resources and options available to them, they needed a risk needs responsivity tool to pair it with. So this tool that you see here on your right is borrowed from D.D. Hirsch, which is a mental health facility in Los Angeles County. So this was borrowed from them, and they tailored it to their needs and their uses in Westchester County. So these are two things that are out there. They're available. If you're interested in seeing these, you can go to the CIT International Best Practices Guide. You can see the Broome County 911 diversion model in there. It's on pages 114 to 116. They happen to be my favorite pages in the Best Practices Guide because it's little old Broome County and we're in there. So I'm pretty proud of that. So, but as you see here, this is the Westchester County model. It's also in the 988 tool that I'll talk about here in just a few minutes. So, and I'll provide resources on that. So next slide, Sam. So so I get the opportunity to travel to a lot of different communities and see a lot of different police departments and do these presentations all over the country. And a lot of times when I ask people, what do you know about 988? In the law enforcement communities, a lot of folks are still unaware and still not understanding what 988 is and how it can integrate and be utilized in 911 services. So if you're not familiar with 988, there's a lot of information out there. There's a lot of funding that's being channeled in this direction now. There's a lot of really good opportunities to work together with our 911 partners in 988. And the tools that you just saw on that last screen are definitely opportunities to use those tools as 911 and connect folks with 988 and vice versa. Honestly, 988 has been transferring calls to us as law enforcement for many, many years as 1-800-273-TALK, the suicide prevention lines. They've been transferring calls if it escalated to the level where it needed an immediate response for many, many years. But the opportunities for 911 to transfer calls to 988 is kind of a new thing, and it hasn't been done on a national scale or anything as of yet. So the 911 project that I was mentioning, we did develop an 8-hour training that goes with that to build the confidence of the dispatchers and give them some de-escalation techniques, really talk about the use of empathy and how to use that as a tool, and then provide them with information on the other available resources in their community. Like I said, back then, we didn't have 988, but 988 that is now here. It's live. It's supposed to be nationwide, and there's still a lot of work. And I compare 988 to 911. We're still making improvements to our 911 system, and it's been in operation for 50 years. So 988 is not going to be built overnight. It's been in live for just over a year now, since July of last year. Folks are doing a great job. They're working hard on it. The federal government's doing an excellent job making sure that the funding is getting to the folks that need it to do the work that needs to be done on the ground. Next slide. So in the last one I'm going to talk about here, and then just provide some other resources, is the Crisis Response and Intervention Training, or CRIT, which you may have heard of. So CRIT is a 40-hour training. It's designed to prepare our officers to respond effectively to people in crisis. It's based on the CIT Memphis model, but the nice thing about CRIT is it's not, if you don't have many folks, when they talk about CIT, they get the T confused with training, and it's actually team. So the crisis intervention team is supposed to be a program where you're really connected with your community folks. You're having conversations about diverting individuals from the criminal justice system. If you're using CIT as just the 40-hour training for your law enforcement officers, this is something that can be utilized too. What the CRIT has done, or the crisis intervention, the crisis response and intervention training, is it's taken intellectual and developmental disabilities, and it's integrated it throughout the entire curriculum, not just a 45-minute module. Typically, you'll have a 45-minute module. Usually it has to do with autism in your CIT trainings. So what this does is it looks at the whole spectrum and the broad different array of symptoms and issues and things that individuals have could experience with intellectual and developmental disabilities. So it's really it's a really good tool and resource to utilize in your law enforcement community as a training model that you can use whatever your crisis response program is. It doesn't have to be a CIT program. It could be a co-responder program. It could be a mobile crisis program. It could be a variety of different things, but it's something that can be utilized. It has the most updated stats that were available to us, and it was written by the curriculum itself was written by our partners, not only in the National Police Association, but the University of Cincinnati was involved in it. The Policy Research Associates, the ARC of the United States, and the International Association of Chiefs of Police. It was a very collaborative effort. It was funded by the Bureau of Justice Assistance. It's out there now and it's live. If Sam, if you could go to the next slide. The QR code here on your screen will take you directly to the site. Many times there'll be information about training and how to do this or how to do that. This academic training to inform police responses is the website that you'll go to on this QR code. This has every single thing that you need, from the nuts and bolts to how to get everything planned and in place and prepare your instructors. But it also has the instructor guides, the PowerPoints, everything that you need to download for free and utilize this tool as a training mechanism in your community for whatever your crisis response is. I've had the opportunity to work on this. I also had the opportunity to be the instructor that went to all 4 of the pilot sites across the country and deliver this training. And the benefits are significant from what I could tell. And the feedback that we're getting is very good too. So I would encourage you to take a look at this if you're looking for a training component. Next slide. Here's some other resources. I mentioned the academic training to inform police responses. That's where you can find that toolkit to do all those different things. I have we have the Bureau of Justice Assistance, Police and Mental Health collaboration on here. So that's not just CIT. So if you're looking to develop co-responders, mobile crisis, case management, your tailored approach for your community, you can find a tremendous amount of resources on this website to help you do that. Law enforcement mental health learning site. So last time I checked, there were 15 learning sites over 11 states. That may be more now, or it may be updated since the website. But this is a really great opportunity. I know Sam has encouraged some of our rural partners to take a look at this. But there's opportunity. We learn together. We learn peer to peer. That's what cops do. So if we have opportunities to connect with other agencies that we think might be doing it right, and they're a similar size, not knocking our large partners or our large agencies like Los Angeles or New York City or those types of departments. What works for them may not work in a 10 or 11 person police department. It's just not feasible. But if we can find someone to connect with that's similar in size to us and have a peer-to-peer exchange, it could just be something as simple as email exchanges, conference calls, or even having one of those learning sites host you and bring you in to actually show you. And that's where we really learn, is when those boots are on the ground peer to peer. So there's opportunities and funding that's available to do those things if you take a look at the website that's here on the screen. So justice and mental health collaboration programs. This is an amazing website. The data from their website, they funded over 600 grantees across 49 states and U.S. territories. So there's funding opportunity. Many of you may have heard about the rural initiative from this website. So, but there's a lot of information on grants and opportunities for funding that you can find there. And lastly is the 988 convening playbook that I mentioned for public safety answering points. The 911 diversion tool that I mentioned earlier is listed as a promising practice in this 988 convening playbook. This was designed by our federal partners at SAMHSA, the Substance Abuse and Mental Health Services Administration, and the National Associations of State Mental Health Providers. I think I got that right. So that was a collaborative effort between them to put those together. So next slide, Sam. Okay, awesome. And that's it for me. I'm here for the whole thing. So let's talk at the end. I'll answer any questions you have, and I'll turn it over to Jim from Crawford County.
All right, how's everyone doing? Sam, is my audio working okay? I had to switch to my phone.
Yep, we can hear you.
Okay. My name's Jim Hackett. I'm the Director of Emergency Management for Crawford County Sheriff's Office. We are an agency of about 50 employees with a population that ranges between 16 and 17,000 people. What promoted us to apply for this grant that we have that created a position was we were seeing an increase in a few things, violent crime related, in Crawford County. And we saw a rise in narcotic use, people in crisis, and sensitive crimes. And we hypothesized that they were all related. So when myself and the sheriff sat down and put our heads together, we came up with this position that I'll be talking about today. So basically, what this position is we created an investigator position that it focuses in narcotics, people in crisis, sensitive crimes, and community policing. And this doesn't do 25% of each. It's a flowing, depending on what trends we're seeing in our area. So we sit down and we do a hotspot map between narcotic use, people in crisis, and sensitive crimes. Then we can track the hotspots in the area, and we're seeing a correlation that a lot of these are overlapping. And that allows our investigator to pick out when he's going to go and use some hotspot techniques to go out and try to basically get the hotspots out of our area. We originally thought what would happen is we'd see it glow really hot on our map and then start to fizzle out. And then we assumed it would displace somewhere in our county. Well, that is not what we've seen. We've seen it grow hot because our investigator is doing a really good job. Then we've started to see it fizzle out, and we did not see displacement. And then speaking with our surrounding counties, we wanted to make sure we didn't displace to them. They're not seeing the increase either. So effectively, we are reducing those three things using this in the way we are. We did send Investigator Breezer to a crisis intervention training. That was an online training. Just because of how times worked out, we wanted to do in person. But our partnership with the National Policing Institute was able to provide us some resources, and we were able to send Investigator Breezer to that crisis intervention training. Now he's able to follow through with his investigations with people in crisis, and hopefully the hypothesis of what we're doing is that we would foresee that they won't reoffend, they won't come back into the system when he's working through them. Just off of some of his stats that he's done so far, we're not even a full year in. And in this small of a county, he's done 77 investigations, which consists of 323 grams of meth seized, 26 grams of fentanyl, 1 gram of heroin, 80 grams of cocaine, 294 grams of marijuana, 15 grams of THC wax, 850 grams of edibles, $34,000 worth of stolen properties recovered, 91 interviews of suspect and victims, 172 charges issued, including federal level charges, and 180 hours of surveillance in hotspot areas. This also does not include all of the extra sensitive crime cases that he has taken on and been able to follow all the way through with his crisis intervention training. Basically, the only challenges that we didn't expect was the fact that our hotspot policing maps we were doing manually. So we'd print our CAD events every quarter and then sit down and map them on Google Maps. And they do have a really cool filter. They actually hotspot so you can see it glow, and then it'll go from a red down to like a yellow and then down to a green. But with his increased workload, because he's doing such a good job, we were struggling to find the time to sit down and make those hotspot maps while we were still doing it in our meetings and talking about where the hotspots were. That's our only struggle that I really see. Sustainability planning, we got really lucky. We pitched this to the county board with this grant. It was funded for a full year, salary and benefits. And the county board turned around and said, we'll give you 2 years. So the grant funds one, we'll fund one. Prove to me this is a position that's needed because you've proven there's a problem, and come back to us and we will fund it. And we are preparing to come back to do that at the end of your year one already and say, hey, look what we've already done. But because it was a position set for layoff until we proved it, we did qualify for the COPS hiring grant that we did receive. So this position will carry on for a minimum of another 4 years.
Great. Thank you, Jim. And I think you're being very kind saying lucky. I think you all have done a lot of work there in Crawford County and put in a lot of effort. So I think that's just showing the fruits of your labor there. So thank you so much.
Thank you.
Yeah. All right. Well, with that, I will turn it over to Chief Andre French and co-responder Dusty Sipes at the Mifflin County, Pennsylvania Regional Police Department. The floor is yours.
Good afternoon, folks. How are we doing today? So I thought I'd start with giving you just a little bit of a picture of who we are. And in doing so, you'll see very quickly the benefit of a co-responder program to us. The regional police here in the county have been around since 1993. We currently provide police service to 3 townships and 1 borough within the county. We are covering approximately 90 square miles-ish. We have an indigenous population of around 17,000 folks, but depending on the day of the week, that number can certainly double. We provide the police service to the countywide junior and senior high school. We also provide police service to the only hospital in the county, Geisinger-Lewistown. The county's made up of various manufacturing type facilities, various churches. We're very much a blue collar area here in the county. Depending on the data set you use, family per capita income in the county averages right around $46,000 to $50,000 annually, making our county one of the poorest in the state. We here at Regional Police, we currently employ 14 full-time police officers. Of those 14, 3 are assigned to the school district as school resource officers, and I have 1 detective doing all my criminal investigations. Everybody else is on patrol. We'll end this year probably right around 4,700 calls for service. Folks who know what the UCRs stand for, Part 1s, that's your more serious offenses. That's what we're targeting here. With these sorts of programs, we average between 15 and 20 Part 1s a month. And depending on time of year, Part 2s will hover between 75 and 100. So we're busy. And we do all that on a very lean budget. Our 2023 budgeted income is right around 1.7 million. So we do a good bit with what we with the little bit that we have. About a year and a half ago, Regional Police was approached by Bob Henry. Bob is Juniata Valley Behavior Developmental Services. In our area, that's the primary agency that deals with those suffering from mental health and intellectual disabilities. They approached us, reference a co-responder program. Now, it was not an entirely new idea. Several years prior, Bob and his agency developed and implemented a pilot co-responder program with neighboring Lewistown Borough Police Department. So my guys had some interaction with Kristen, which is a co-responder for Lewistown Borough, and very quickly bought into the concept that, hey, these co-responders are a valuable resource. They can do a lot for you as an officer, and maybe more importantly, they can do a lot for the community in general. So our co-responder program has been up and running since mid-January of this year. So we're also brand new. We brought Dusty in at that time. He's actually an employee of an agency called Center for Community Resource, but he is assigned here full-time as our co-responder. Dusty really hit the ground running. And again, it became readily apparent the value of that position and what he can do for the folks on the street and the community. So I'll let him talk a little bit about the nuts and bolts about what he does.
Sure. Hi, my name is Dusty. I've been in the mental health field for probably a little over a decade now, working in a variety of fields, case management, crisis, TSS, behavioral health at a school-based programs. So it was kind of nice coming into the program, already kind of connected to a lot of the providers in the area. But one of the things that we wanted to establish first, and I work with Kristen Weiser, she is the borough co-responder quite regularly. We attend regular meetings with Geisinger Medical Center. We go up there once a month to talk to the individuals on the unit, provide support, talk about discharge planning and sustainability. There are a lot of issues that come up with individuals, like in financial situations, and we work with those kind of more of a long term instead of just putting like a band-aid on it and going, okay, well, you guys can figure it out. We work with them, for as long as it takes until we're able to establish sustainable services. One of the difficult things, and I think this is pretty much across the board, especially in smaller town America, is there's just a lack of providers, and wait lists are extremely long in cases. Where we're at here now, like a prime example is, I was talking to a guy who was trying to get just an appointment with his PCP, and there was a 3-month wait list for that. So when we're looking at mental health services, unfortunately, 3 months is nice, and that's unfortunate. Somebody's in a state of crisis or going through a lot of difficult times. We try to stick with them, call them and check in, make sure that they're doing okay. That way we can kind of bridge the gap before they are able to get long-term sustainable services in place. Other agencies that we work with the Area Office on Aging. We are noticing some individuals who are really struggling, or who have parents or loved ones who are dealing with Alzheimer's or dementia or things like that, and they're at a point in life where they have to make some really incredibly difficult situations, or incredibly difficult decisions. That's the word. Sorry, it wasn't coming to mind there. About what to do with their loved ones long term. So Kristen and I work with individuals trying to coach them through that process and get them with the right agencies, during that difficult time. Other places we work with drug and alcohol, as with every place in America. There are drug issues here in Mifflin County as well, and we try to help people up with that. Another thing that we try to do is work with area case managers. I'm always a selling point. Like anytime I meet an individual, I'm like, do you have a case manager? If not, let's get you one. Just because a lot of people are dealing with multiple issues at one time, but they're just not sure exactly which avenue to start with first. Like they may be missing insurance, they may be having an appointment in 6 months, and a plethora of other things. So we work with the individual case managers as well to kind of holistically look at everything, you know, bounce ideas off the case managers, because unfortunately with that field, there's a lot of turnover, and you have a lot of younger people who are just maybe not familiar with the services in the area. And Chris and I have been doing this for a long time, so we can even kind of give information to the case managers of services that they could try to help their individuals with. At the same point, case managers up here too are also very overworked, and they sometimes have caseloads of like 30 or more people a month. And having done that in the past, I know it's extremely difficult to manage 30 people's lives, including your own. So we try to let them know of other services or behaviors we may have noticed talking to individuals when the case manager isn't around. As far as public outreach, I didn't write the exact month, but I think within the last 6 to 9 months, we've done 19 community related events. That is like we had the End Suicide Walk Out of the Darkness here not too long ago. We are involved with Trunk or Treat, the Halloween Parade, the Huntington County Fair, things like that, getting information into the community. We also work with I think this is a pastor actually reached out to us. We met recently with church officials in the area who are noticing an uptick of members of their their parish or their congregation, who may be experiencing things that they're not exactly sure what to do with. So we've met with a variety of them, talked about when to call police, when to call crisis, services that are available in the area. And we've offered to meet with those individuals with the pastors themselves to kind of debrief and, explain some things as well. As far as recent successes, I'm trying to think. I work a lot with the school. The resource officers have an absolutely fantastic relationship with a lot of kids at the school. And in lieu of crisis, going there regularly, I try to go over when humanly possible. That way the kids see me and they have a familiar face and they're more open to talking about things. Like I say, a recent example was a kiddo who was having auditory visual hallucinations that were telling him to do things. And he had never talked to his mom about any of these things going on. So after we were able to build a good rapport with the kid, being with him for an hour or two, he was cool with bringing mom in, and we had a nice conversation. And now this kid is back on track, not having hallucinations, on the right medication. We talked with mom about how to advocate for services that he needs. And that's the most recent one that comes to mind. As far as difficulties, like I say, staff turnover, retention, availability, long wait lists, those can be issues. I know something that's been brought to my attention a time or two is people say, well, I don't want to go to the hospital. I don't want to get services because I simply can't afford them. And so we work with the assistance office here in town as well to try to get them, medical assistance, get them set up so that they don't have to, worry about that. And so that's me.
I think the last question we were supposed to address would be sustainability of the program overall. It's one of those programs that you don't know what you don't know. Now that it exists, you see the extreme value in what it can provide to the community. And certainly we're small town. We're small town USA. And the agencies that Dusty's talked about, we all recognize the value of this particular program. And so sustainability going forward is going to happen. Primarily through that agency that I discussed, what we call Juniata Valley Behavioral Developmental Service. That's the agency in this area that provides for those with intellectual disabilities and mental health issues. And they have pledged their support. They are 100% behind this program. They know it works, and we're committed to making it work here.
Awesome. Great. Thank you both so much for that. All right. So now we are going to move into our facilitated discussion and Q&A session. So I am going to stop sharing my screen in just a few moments, just so that I can see what I call the family of squares. So that I can see if folks are in fact raising their hands a little bit more easily because they want to come off of mute. In the meantime, for those of you who would prefer to write your questions or your comments in, please feel free to use either the chat or the Q&A feature that you see down at the bottom of your screen there. You can choose to send those to the entire group, or if you just want to send them to the host or the panelists, you can do that as well. So with that, I'm going to stop sharing just so that I can see everyone, or at least a few more people at a time. And so for those of you who are curious, go ahead and feel free to send those in. In the meantime, I am going to start with some questions. Jim, this one is directed at you, but Chief and Dusty, I have a feeling you will want to add on to this after, so I'll let you have that option as well. But Jim, the question for you is, what characteristics or qualities do you think that Joe has that makes him so effective in that position?
I think it's his dedication to the position and truly caring in it. I truly think that this position is so successful because the individual we chose, and he did have a very proactive approach already to a lot of these functions. And then when we asked him to go to crisis intervention training, he was all on board. He absorbed the training. He's using it. I think you got to have someone that's a go-getter in this position, because he might be Monday 2 to 9 o'clock at night today, and then turn around and tomorrow he's midnight to 4 a.m. because he got some tips in, and or he's working a sensitive crime, and he's kind of all over the board. And how we run it is we let him work a 40-hour week, and he gets to make his schedule depending on what is going on in the area off those hot spots and what is coming on. And he's just got to be in one of those 4 areas that we talk about.
Awesome. Thank you, Jim. Chief, Dusty, anything that you all would like to add to that?
Maybe real quick, for those that are just implementing or thinking about implementing the program, do your interviews, do your due diligence. You gotta pick, you can't pound the round peg into the square hole. You have to choose your co-responder, or in Jim's case, his investigator, who's going to be a great fit with the department, who's going to be a great fit in the community. And those are the 2 factors when you're looking to fill these types of spots.
Great. And then if you all want to stay on camera, the next question is actually for you. And Jim, you hit on this a little bit in your answer, but for Mifflin County specifically, Dusty, are you going out on calls with the officers or Kristen when it's in the borough? And if so, what does that look like? And then also, what hours are you all available to go on calls?
Absolutely. I have my daughter every other week, so we do flop it around a little bit. So one week I do 10 to 6, and then the following week I do 12 to 8. Obviously, if calls come in late, we're going to do a late evening here, and that's okay too. But the calls that I typically go on, I go to clearly mental health related ones, but we also go to domestic incidents. If there's any drug related stuff, go to as well, just to kind of assess the situation, kind of see if we may be dealing with somebody who is on drugs, or might be a more long-term mental health problem. So yeah, I tend to go out on those primarily. But yep.
Great.
Was there a second part to that question? I apologize.
Well, you hit it. You hit the hours one first, so that
I did. Okay.
Yeah. So you were already thinking ahead. Yep.
Okay. Sounds
awesome. All right. Our next question, Mike, is for you, related to the SIM workshops. Someone asked if you could give an example or kind of an overview of what that in-person workshop would look like, or how those generally flow.
Sure. So the sequential intercept workshop, as I mentioned, is about a day and a half. And typically it's the people that run those workshops provide you with a list of individuals that you would want to invite to that. So it's very prescriptive in who they want in the room, and who the best people to have in your community are in the room. So they kind of describe it as when you're identifying or establishing a wedding list. You start with the really high numbers, and then you have to kind of whittle it down to make sure that you can control the chaos in the room, right? So a good sweet spot for a A workshop is probably any place between 30 and probably 50 at the most people that would be in a very large, typically a U-shaped room, so everybody can see each other and talk and communicate. And then they have a list of questions that they go through, and they start mapping out your system as they're answering these questions. And the first question they often ask is, what happens when someone calls 911 in your community? And then they go forward from there, and they take that individual right through the system. So each person so the participants that are in the workshop are representing their specific intercepts. So there's folks in the room that can answer what happens to those individuals as they go through that criminal legal system. And then what happens when they get towards the end and they unfortunately sometimes go back into the system for violating, or they get out of the system, and then do they come back into the system at the other end? So there's a lot of really good discussion. The facilitators are trained in how to manage difficult conversations too, because a lot of times an organization or agency may say, this is what we do, this is what we provide, but then the first responders that are in the room may have a different or variation of what that might look like when it's actually from paper to practice. So it may not be happening the way that the folks are thinking that it's happening out in the field. And those are opportunities to do quick fixes and troubleshoot those things and have those really difficult, sensitive conversations with the individuals in the community that may think it's working one way, but the first responders or other folks may say, yeah, that's not really what happens. This is what kind of happens, or this is what I've experienced. And they can work through and sort those situations out and really start to develop those relationships and build those. So day and a half takes about 3 months to plan it, to coordinate it, to get it together. They usually come right to the community. They have done them online over Zoom. I've done them myself online over Zoom. Being a person that's done them in person and a person that's done them on Zoom, the Zoom ones are okay, but the in-person ones are really where you get the work done and you get to meet the people that are in your community and are representative of those other organizations that are working with the same individuals in your house.
Great, thank you, Mike.
Mhm.
All right, and I am going to switch it up a little bit, and instead of asking one of the next questions, I'm told that we have Kewanee, Illinois on the line as well, and that they are developing a partnership with their county health department to help with kind of follow-up services and referrals. So Chief, I believe you are on with us. I don't know if you're able to come off of mute and just talk a little bit about what you all are doing there.
All right, can you guys hear me?
Yep, we can hear you.
All right, perfect. Yeah, so we applied for this grant, and the how we started is it's called the DART program. It's the Drug and Alcohol Addiction Response Team. It started off with basically one officer assigned to that unit, and has now progressed into all of our officers being involved in the grant to help with the services. As we were seeing, that it's just a lot for one guy to handle by himself. And so a quick rundown of that is kind of like what we've heard today with other programs, is that we have that detective assigned to go out into the community, whether it's on a call or individuals we know are suffering from mental health or alcohol addiction or drug addiction, and help them with their daily problems to try to get them to outpatient therapy at our local Henry Stark health department has counselors on call. We also established a relationship with our local Bridgeway, who provides therapy services. We were able to purchase a van through this grant, which has been extremely helpful for individuals getting places. We've transported around 10 individuals out of town to inpatient services, and we continue to monitor them several times a week. Well, hey, are you taking your medicine? Are you getting to your appointments? And we'll get them to different resources. We're not really providing any therapy. We're just helping them get to it. We do little things like help them with job applications, things of that nature.
Great. Awesome. Thanks for sharing. I know I was a little on the moment there, so thank you.
No problem.
All right. Well, folks, I'm going to try to squeeze in just one more question before we close out today. And so I think both Mifflin County and Crawford County, you both may have some say on this one. But Mifflin County, you specifically mentioned coordination with your SROs. And so can you talk just a little bit more about what that looks like in terms of in the school systems, given that there are juveniles there and any special considerations that that has?
Yeah, what happens sometimes, we do have one SRO who's, I believe it kind of goes around from building to building from time to time when other ones are out. So if there's any issues going on at the school that day, they'll typically notify me, give me a call, shoot me a text, and then I can kind of fill in at the spot, you know, if an individual needs, you know, one-on-one support for that specific day. And like I say, it just really kind of helps to build a good relationship with the kiddos. I know sometimes, you know, having like a crisis counselor come in or something, it can be kind of daunting, you know, for their first and only interaction. Whereas if it's, you know, not a frequent flyer, but a regular kiddo, it helps to build that relationship so much better, and being able to communicate with the SRO, like things that they had or experience, and they can provide extra support too. So they have, you know, an extra support at the school. Essentially, it's really nice to have that communication. You know.
Awesome, great, thank you, Jim. Anything on your perspective on that one?
Yeah, our investigator works very, very close with our SRO. She's actually involved in a lot of our meetings and hotspot, just because in case it's a juvenile as well, they work together. And something I forgot to talk about was he also does a liaison towards our human services. So he keeps involved in meetings with human services, and then they can compare who they're dealing with just to make sure if there's crossover that they're able to work through any services together. So those are two important partnerships that he does work with on a weekly basis.
Great, thank you. All right, folks, we are coming right up here about 5 minutes to the hour, so I am going to move us back into our PowerPoint just quickly. And so do want to flag that quick reminder about the feedback evaluation survey, so you can get to that one of three ways. One is the QR code here on the screen. Two, my colleague is going to put the link in the chat as well if you'd prefer to click the link. And it's also going to appear when you close out of today's event automatically. The other way is still through the link as well, but in our follow-up email, you will see that survey link in there too. The other quick reminder that I wanted to flag for folks is, as we talked about in the beginning, that feedback survey is a really good place if there's any specific topics that you are interested in for future events. That feedback survey is a really great place to put those. And John and I are beginning to plan for those 2024 events. I know that seems very far in advance, but it is December. We're already here. And so with that, those are kind of my final closing comments. I do just quickly want to give both John at LISC and Juliana at BJA the opportunity to make any closing comments. So John or Juliana, anything that you would like to add?
I would just jump in first, Samantha, and say really great discussion today. Want to thank you, thank Jim, Chief French, and Dusty for the conversation, and for everyone joining today. Hope you found this discussion helpful, but I thought it was a great opportunity to learn more about crisis response. So thank you.
Thanks, John.
Just echoing what John said, I appreciate everyone's time today and all of the great work that everyone is doing, and really enjoyed hearing about what some of the excuse me, RVCRI grantees are doing with their funds. So thank you, everyone, and thank you, Sam and John.
Wonderful, great. Well, to just add to the round of thanks, thank you to our presenters and our panelists today, those planned and also those that I put on the spot a little bit. Thank you for that. And then also thank you all for the questions that you've put in there. That's what makes these events so great, is the ability to chat and kind of learn from each other outside of kind of the typical webinar setting, right, where it's mostly a presentation. So the Q&A session is very limited there. So thank you. With that, we will close out for today. As we mentioned, we did record today's event. We will send out a notice once that recording is available. If you do have any questions or follow-up from this, please feel free to email them, and John and myself will get them where they need to go to get you a response. With that, thank you so much. Have a happy holiday season.